Coming up on the FSR Sarc Fighter podcast, an up-close and personal look at Neuro Sarcoidosis.
Yeah, so certainly your history and your MRI imaging were consistent with inflammation involving the spinal cord.
Yeah.
And it's not the typical causes of inflammation because it was going on for a much longer period of time than you would expect to see with something like multiple sclerosis.
That's my doctor, Dr. Brandon Moss at the Cleveland Clinic. He'll be talking about neurosarcoidosis, and when necessary, today, I've told him to chuck the HIPAA restrictions and to use me as an example.
Rough estimates, and these are very rough, is that after 2 years, about half of people can come off of their treatment. After 10 years, about 2/3 of people can come off of their treatment. But that still leaves a sizable number of people with long-standing disease who need to be on therapy for a while.
All right, in fact, there isn't much I haven't already shared with you anyway, but it's all coming up on the FSR Sarc Fighter podcast.
This is the Sarc Fighter podcast, living with sarcoidosis and other rare diseases. Here's your host, John Carlin.
Hi, and welcome to episode 137 of the FSR Sarc Fighter podcast. I am John Carlin, your host and newly minted member of the FSR Board of Directors, as I announced on the previous podcast. I haven't even actually attended a formal meeting yet, but hey, I'm on the board, and I just want to let you know where I'm coming from. The date of this recording is April 25th, 2025. My recording with Dr. Moss is just a little bit older than that. But Dr. Brandon Moss is at the Cleveland Clinic, and as I've told you in the past, that once I figured out that sarcoidosis wasn't going away, that it was going to sort of dictate my life from that point forward, and it was just going to be something I had to deal with. I felt like I had to get serious and to find a clinic where they were dealing with sarcoidosis every day, as opposed to my local doctors who, while being very good doctors, only have maybe a handful of sarcoidosis cases. And sometimes when I talk to guests on the show, they have a doctor that's never had a sarcoidosis case. They might be the only one. So I kind of felt like, I need to find a sarcoidosis clinic where that's what they do. And I searched around. I landed on Cleveland. Even though it's a 7-hour drive from my house here in Virginia, it is a bit of an inconvenience, usually a 3-day trip. It involves a hotel stay and that kind of thing, but I have found it to be worth it. I'm not going to lie. It's one of the best decisions I've ever made. And we haven't talked a lot about neurosarcoidosis on the show, and I felt like it was time to get it out there. And instead of hypothetical situations, I just told Dr. Moss that he could go ahead and use me as a sort of case study so we would have a reference point for the discussion. So, when you talk about, I have spinal involvement with my neurosarcoidosis. If he's talking about somebody who has it in their brain, for instance, that's a hypothetical. But if we want to talk about spinal, I can say, well, use me as an example and blah, 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 blah. Not to make it about me, but just to say, look, I kind of can ask informed questions about that, and I don't want him to feel shy about talking about that. And just to give you a quick update, I have a mass or a granuloma on my spinal cord at about C6, which is the back of my neck. It was and actually is blocking signals from my brain to my lower extremities, which causes numbness, tingling in my arms, my fingers, my legs, creates sort of an awkwardness for me, which I've talked about at length. If I try to run or like I tried to skip the other day, just about impossible. Anything that isn't just straight up walking is very, very awkward. And it's just because of that loss of signal from my brain to my legs. And it's a bummer. But I've learned to live with it, and it is what it is. And for the record, since Dr. Moss has started taking care of me, it hasn't gotten any worse, and I haven't had any flares. So that's the good news. And now we're looking back on pretty much since mid 2019 was a bad year when Dr. Moss really threw everything in the book at me, and it hasn't gotten any worse since then, although the medication was worse than the illness for most of 2019. But now we're looking at 5.5 years or so of not getting any worse, and I'm going to take that as a win. So we'll be talking about spinal cord and brain involvement and pretty much anything else having to do with Neuro Sarc. Now, as I record this, the weather has finally broken in Virginia. It was a long, cold winter here in the mountains, but now the azaleas are flowering, the grass is super green, growing fast. I'm mowing the lawn probably twice a week if I do it when I should. The temperatures have moderated into the 70s, so I've been out riding my bike, and I need to, not only because I love it, but I'm prepping for a bike trip to Amsterdam and Bruges in Belgium. And the plan there is to ride bikes about 40 miles a day and then eat chocolates and drink beer to my heart's content. To the extent that I can, that it's enjoyable, and perhaps I should be thinking about taking in the views of windmills and tulips and the culture and the history of Amsterdam and Belgium. So I'm looking really, really forward to immersing myself for a week and a few days in the bike culture over there. And I'm doing all of this while reverting to my Atkins diet. I was trying to drop 10 pounds before the trip. So far, I've lost 8 in a month. I'll take that. Lots of protein, almost no carbs, but I did let it slip a little bit on Easter because there was so much candy around. All the grandkids running around, Papa, look, I got a chocolate egg. Do you want one? I'm like, yes, yes, I do. So anyway, you got to live, right? But the weight loss has gone okay. And I expect that I might gain it all back, even though I'm going to be doing so much bike riding in Europe. But that's okay too. But I didn't want to add another 10 on top of that, so I'm giving myself a little room to play with there. All right. There's a bunch of news out there that I want to talk about going on in the sarcoidosis world before I get to the interview today. First of all, there is the Living Rare study, which is led by the National Organization for Rare Disorders, better known as NORD, N-O-R-D, and you can help fill this critical information gap and drive meaningful progress if you want to participate. And I'm just going to read some of what they sent out. It's not really written for the ear, but this is just the best way to get through it. So stick with me here. But the Living Rare study is the first large-scale, long-term research study in the United States dedicated to capturing the comprehensive experience of living with a rare disease. And the more people who join, the stronger the data becomes, helping to fuel improvements in research, healthcare, and resources that benefit everyone living with a rare disease. It's open to people living in the United States diagnosed with or suspect they have a rare disease and their caregivers. It covers healthcare access, daily life, financial, emotional, and social impact. It takes about an hour to complete, and you can do it at your own pace. It's available in English or Spanish, and there is an ongoing impact. You can update your information yearly to track how this is going on. So your voice matters. By sharing your experience, you can help shape the future of care in your community and the 30+ million Americans living with a rare disease. And to learn more and to participate, visit www.livingrarestudy.org, livingrarestudy.org. And so I'm going to put that link with the description in this podcast, and that is an opportunity for you as a Sarc patient to jump in and make your voice heard, and let's help NORD do what they do by giving them a good data point. All right, coming up June 28th through the 29th, I want to invite you to United for Progress, a new chapter in sarcoidosis, which is the FSR Virtual Global Summit. It's always a fantastic event. It is virtual again this year. It's a 2-day event packed with expert-led sessions, networking opportunities, and a wealth of resources designed to empower patients, caregivers, and clinicians. And this year's theme, once again, is United for Progress, a new chapter in sarcoidosis. And it'll be highlighting the power of collaboration, education, and community in advancing sarcoidosis care and research. So there will be hundreds of people attending this event. It's impacted anybody impacted by sarcoidosis. You'll be hearing from world-renowned experts on the latest research and treatments. You can connect with other patients, with other caregivers and supporters in interactive discussion forums, group video chats, gain insights from over 20 live sessions, personalized tracks, and unique and rarely discussed topics, and explore virtual booths featuring top sarcoidosis clinics, support resources, and emerging therapies. Now, I've been a participant, sometimes a discussion leader at previous FSR Global Summits. There's a very good chance that I will be this year. I'm a little bit ahead of the curve right now, but typically if there's a discussion forum or something, I'll participate with that and make it somehow a part of the podcast going forward. But it's just excellent. Think like you're going to go to a hotel and there's all these breakout sessions and there's all these rooms where experts are set up and you can go and walk around. You can see the booths set up by the pharma companies or Nord, whoever might have some skin in the game when it comes to sarcoidosis, and you walk around and you talk to these folks and you learn a little bit more. You talk to your fellow patients. Well, that is all going to happen, but it happens virtually. So you get on your computer during those 2 days, and it's June 28th and 29th, and you ping around and you join into these conversations that you think you're interested in, right? And it's a wonderful, wonderful event, and it really advances the cause every year. And you'll find out the state of sarcoidosis for sure by the end of the weekend. So and this is from FSR, to celebrate FSR's 25th anniversary, we're offering a special early bird rate to sign up of $30 a person until May 15th. And then after that price increases to $40. However, some scholarships are available, and there is a link there if we don't want people not to do this because they can't afford it, okay? And the $30 or the $40 really just covers expenses. But there is a link for the scholarships, and I will put that again with the description with this podcast, and that you can do it that way. So either sign up, get the early bird special if you get there by May 15th, 2025. If not, it's only $40. And again, there are some scholarships available. And if you just want to straight up register, there's also a link for that, and it will be with the description. The other thing I want to talk about before we get to the interview, something very interesting that FSR is doing, and I had a brief conversation behind the scenes with Mary McGowan and Tricia from FSR about something that they really want to get out there, and that is the concern over the smoke from the fires out in California earlier this year. You're probably aware, of course, the Hollywood fires, the fires in Los Angeles. And the fact that we know that there's something in smoke that can trigger sarcoidosis. The most famous example of that is after the World Trade Center collapsed, right? In the terrorist attacks. And following that, there was all that dust and all that smoke, and the incidence of sarcoidosis in New York City went through the roof. And we know that there is some sort of an association, some sort of a trigger that happens. And N95 masks seem to be a good way to prevent the onset of sarcoidosis for people who now have to be exposed to that smoke on a continuing basis. So FSR is partnering with Walgreens and Cedars-Sinai, and they're providing N95 masks at 2 locations in Los Angeles with the goal of helping members of the community protect their lungs following those wildfires in January. And here's what we know. We know exposure to fine particulate matter from the soot and the ash and the wildfire smoke can have a damaging effect during cleanup and even after the fires are out. And so the nonprofit noted in a foundation press release, which I'll put a link to in the description, why they want to do this. But the free N95 masks will be available at the Foothill Utility Center in Pasadena and Monrovia. And Mary McGowan is quoted here as saying, prolonged exposure to smoke and particulate matter can have long-term health implications, including an increased risk of developing sarcoidosis. And again, that's directly from Mary McGowan, the CEO of FSR. So, what could they do? Well, we got Walgreens involved. They're going to provide these N95 masks. And I have a feeling, I don't know this for a fact, I just have a feeling that this will be an ongoing thing because these wildfires aren't going away. You turn on the news, or I report on the news all the time about global warming and firefighters. There's a big forest fire right now in New Jersey, which is not an area you think of these big fires in the Midwest. There's been some in Canada, but because of global warming, these fires are everywhere. And the exact reason why the immune system becomes overactive in sarcoidosis is unclear, but we do know that toxic exposure to smoke and fine particulate matter appears to play a role, as supported by an increase in sarcoidosis diagnosis after, again, 9/11 responders. So FSR is getting in front of this. They are putting these masks out there. They've found a corporate partner in Walgreens. Thank you to Walgreens. And I have a feeling that this is just the beginning of this kind of a partnership as firefighters and people in general are exposed during the cleanup with these forest fires. So I wanted to put it out there that FSR is doing that. This is the first example of it, and I just think it's great. This was reported, by the way, I know about it from being an FSR, but Sarcoidosis News also reported it on April 21 by Marisa Wexler. So just really glad to hear that FSR is doing that. And I know that it's one of the areas that they are interested in looking at because I've had some behind-the-scenes conversations with them about looking at the impact of forest fires in particular on sarcoidosis. Okay, I kind of got into my auto-speak mode there, and I do apologize, but sometimes that's just the easiest way for me to get through all this information and get it to you. All right, that's the latest news. My talk with Dr. Brandon Moss is coming up here on the FSR Sarc Fighter podcast.
I feel like a zombie, just feeding and stumbling.
Hi, I hope you're enjoying the Sarc Fighter podcast. You may be wondering, what can I do to help? How can I be a part of the sarcoidosis solution? It's simple. Make a donation to KISS, Kick In to Stop Sarcoidosis. 100% of the money goes to the Foundation for Sarcoidosis Research. Look for a link in the show notes of the Sarc Fighter podcast. Welcome back to the FSR Sarc Fighter podcast, and joining me now is Dr. Brandon Moss, the director of the Neuro Sarcoidosis Clinic at the Cleveland Clinic, and also my doctor. So, Dr. Moss, thank you for joining me today.
It's great to be here.
So, neurosarcoidosis is not something we get to talk a lot about because there aren't many of us out there. Can you kind of maybe set the table for us in terms of how rare neurosarcoidosis is?
Yeah, no, it's a great question. So, the estimated prevalence for sarcoidosis as a whole is around 150 to 200,000 in the United States and 1.2 million worldwide. Roughly 10% of those have neurologic complications of disease. Although those are based on estimates that are primarily from people who had pulmonary manifestations like lung complications from sarcoidosis, and then also had neurologic complications. So it might be a little bit of an underestimate.
Okay. So, well, we always see people that have multi-organ involvement with sarcoidosis, right?
Right.
Many of the people who have joined me on the podcast over the years talk about all that, and then they found it in my spleen, and then um, so and listeners probably know, but I'll just assume that there are some new listeners to the podcast that I have neurosarcoidosis on my spinal cord, in a terrible place, but that's the only place that I know that I have it.
Right.
Although there may have been a rash that you and I have talked about around my ankles very early on that could have been a precursor, but didn't look like a rash. Looked like a bunch of bug bites that were quite far apart. Like when I think of a rash, I think of like something that's almost continuous, and these were like, but other than that, I don't have any other manifestations. So how rare is that situation then?
Yeah, it's a good question. I mean, we have a rough idea. So in general, estimates are that 80 to 90% of people with neurosarcoidosis eventually have some other manifestation of sarcoidosis in another part of their body. Most commonly the lungs, the skin, or the eyes, but that could be other places as well. But that's still, up to 20% of people who just have sarcoidosis involving the nervous system. And it leads to some challenges. I would say the biggest is in terms of diagnosis. So, biopsy is a major issue in terms of giving us confidence that sarcoidosis is the disease that we're treating and that we're not missing something else. You're not going to be as aggressive as someone when you don't have biopsy confirmation that sarcoidosis is actually what you're dealing with. And so that can be a challenge. It can even be more of a challenge because even though eventually 80 to 90% of people with neurologic manifestations have some other disease in their body, systemic organ involvement, at presentation, it's only half, so 50% of people. So oftentimes neuro complications are the first thing that people present with, and you may not have anything else to biopsy at the time that you're doing the workup.
Wow. So let's use me as an example. They were searching for something that was causing tingling in my lower extremities.
Right.
Started out my feet, then started moving up, and so they kept searching my spine. Then they found this mass, basically in the back of my neck around C6. Thought it was transverse myelitis, which I guess on an MRI, does that make sense? Would that be the first thing that you would think of if you saw that sort of inflamed area?
Yeah, so certainly your history and your MRI imaging were consistent with inflammation involving the spinal cord.
Yeah.
And it's not the typical causes of inflammation because it was going on for a much longer period of time than you would expect to see with something like multiple sclerosis or some other causes. So, it had to be something that was causing sort of a more long-standing problem, a more long-standing process. And then the MRI imaging was definitely, consistent with the clinical history and with some kind of cause of inflammation.
Right.
It's still difficult to separate out other inflammatory things too, and other infectious things too. So, there can be a wide variety of things that can cause similar findings on MRI. Some are inflammatory disorders, some are infections, some even lymphoma, which is one of the things that we have to exclude when we're doing a workup for sarcoidosis.
Right.
So it gets a little challenging up front, but once you're confident in the diagnosis, then you can procead with treatment relatively quickly.
Right. So I wound up eventually having a biopsy, and lo and behold, it came back as sarcoidosis, which I had never heard of. So, and My dogs may bark right here. I'm sorry. Uh, just a little dog is barking. As long as they don't all go crazy, it'll be fine. And heaven forbid that the FedEx guy should come, but we can cut all this out. Um, so lo and behold, I get diagnosed with sarcoidosis. Uh, and I eventually made my way to you because I was feeling like my local team just didn't have the experience. They don't see enough patients. We're too small an area, even though we have wonderful doctors here in the region. So I make my way to you, and you guys looked at it, I assume, as a team, and came back with, we want to hit you hard with a lot of prednisone and Cytoxan. Um, what can you hear the dogs barking?
No, I couldn't hear.
Yeah. Okay. All right. So you come back and you want to hit me with a lot of prednisone and Cytoxan. What made you decide to go so heavy on me
Right.
at that time?
Right. I mean, part of the concern was that your inflammation was never completely controlled. And that's despite treatment with medications that we think of as being very potent for treatment of sarcoidosis. So at the time I saw you, you were on azathioprine, which is, a decent medication for a lot of patients. There was still evidence of inflammation on the MRI, but even more so, looking back at your prior MRIs on Remicade, which we consider to be very potent, it didn't look like there was a whole lot of change. I mean, there was improvement. There's no doubt about that. But the inflammation did not go away, and there was still a significant amount of inflammation there. So that was the concern. The concern was that you still had active disease and that you had active disease throughout the entire time you were treated prior to seeing us.
So I have yet to find anybody else who ever was treated with Cytoxan, which is a sort of a low-grade chemo drug. What led you to that?
Yeah, so I mean, it's not in favor anymore, primarily because Remicade tends to work so well. And so there are other treatment options that have fewer side effects over the long term. Cytoxan over the first 6 months, usually, fewer complications. Longer than that, you can start to run into issues where people are at increased risk for bleeding in the bladder and increased risk for other more serious complications that can cause problems. So, our estimation was that if we treated you with a 6-month course, we could help slow the inflammation down and then transition you to another medication like Humira, which we ended up doing, to help control the inflammation longer term. And that was, in part based on the estimation that the Remicade had not fully controlled things when you were on it initially.
So yeah, we keep tracking, every time I come see you, we get a new MRI, and
Right.
there's still a little bit of a lesion there, but it's
Right.
difficult to tell the difference between what is ongoing sarcoidosis and what might be scar tissue. Can you
Right.
talk about that a little bit?
Right. The main way we do that is with a special sequence on the MRI when we administer the contrast dye. So it's not perfect because even if you have leakage of the contrast dye in the affected area, it's not always inflammation that's causing that. But most of the time, inflammation is the concern. And so if we see that there is leakage of the contrast dye on that area of the MRI, then we're concerned that that represents active disease and we need to treat it. One thing in your case, which I would say it's highly variable from one person to the other, even though you had evidence of active inflammation on imaging, clinically, you were still doing very well. And so we thought that we had some more time to think about this, to evaluate this, to treat this, to try different things, and to come up with the best treatment approach moving forward. And that's a luxury that you don't always have. Some people come in and they look a lot worse than their MRI imaging does. Some people come in like you and they look a lot better than their MRI imaging does. And so, I think it's important to remember that there can be differences between the imaging and the clinical presentation. And we do favor, the clinical presentation more than anything else, because that tells us, what's most likely going on actively in terms of your functional status and how you're doing.
Yeah, so you have said that a lot of times it, it sort of burns itself out.
Right.
Can you explain that so people understand what that's about?
Yeah, so I mean, it is well recognized now that over time, the inflammation from sarcoidosis tends to decrease, and eventually, for most people, resolve. Now, that's different from person to person, and it's difficult for us to predict who's going to need a longer course of treatment, and who's going to need a shorter course of treatment. And I have even had cases where people have spontaneously resolved. I would say that's the exception, not the norm, but their inflammation has gone away without any treatment whatsoever, which would be ideal if you could get that for most patients with sarcoidosis. Rough estimates, and these are very rough, is that after 2 years, about half of people can come off of their treatment. And after 10 years, about 2/3 of people can come off of their treatment. But that still leaves a sizable number of people with long-standing disease, who need to be on therapy for a while.
So now you have got me taking Humira and azathioprine, both,
Yeah,
and I'm using a biosimilar to Humira,
right.
which is because my insurance doesn't want to pay the cost of Humira,
Right.
which I guess I understand. Do you have any idea what it costs them to pay for a dose of Humira?
These are always challenging to know for sure, in part because these are safeguarded. So it's considered proprietary information. And it's important to remember that oftentimes your insurance goes through some pharmacy benefit management company. They have their own negotiated rebates for, different drugs. So within the same class of medication, you might be highly preferred to be on Hadlima, which is what you're on right now, versus Humira, which is what you were on before. It's hard to know without knowing what the plans are, and oftentimes we don't have access to that.
Yeah. But I mean, I've heard estimates like $14,000 a dose or something. That's not
Yes,
off the charts. That's about right, isn't it?
that's correct. These are expensive medications. Yeah, and I would say, certainly the Humira is expensive, but I would say the biggest expense comes from the infusions like Remicade. Those are the big ones.
Okay. All right. So now, and what is Humira doing in someone's body, generally speaking, in layperson's terms, that makes it work, that makes it combat sarcoidosis?
Yeah, no, that's a great question. I mean, it works similarly to the Remicade infusions. It's within a class of medications called tumor necrosis factor alpha inhibitors. That's just a long, fancy name for the kind of molecule that it basically blocks signaling for. So these are all little signaling molecules that your immune system cells use to communicate with each other. And this one in particular is important in maintaining the type of inflammation that's common in sarcoidosis, the granulomas that people see in sarcoidosis. So it basically blocks that signaling molecule and helps prevent the granulomas from continuing to stay active.
Yeah, so it's a TNF inhibitor. That's what people
Yep.
typically call it. And um, it- it's amazing that they've figured this out. But it's still kind of a band-aid because we don't know what's triggering the sarcoidosis to begin with. It's just sort of cutting it off at the pass, as it were, before it can manifest. It's the trigger says, "Oh, sarcoidosis, let's start it," and this thing cuts it off at the pass, right?
Right. Yeah. No, I mean, I think that's a great description. Yeah. I mean, we still, and in part, we're a little bit limited because we still don't fully understand all of the pathophysiology of the disease. We don't exactly know how you go from, having an increased risk based on sort of multiple genes that might play a role in sarcoidosis to having the disease itself. There's an environmental component that I think is still being sorted out. How those risk factors interact with your genes is still being figured out. And then what pathways we can target to treat the disease is still being figured out. Although we've got some ideas and some, good medications that we can use for the disease at this point in time.
Do you feel like there's progress being made?
Yes, I definitely do. And I think that in particular, with a field of study called genomics and proteomics, where they really look at almost cellular data within tissue, and they can tell you all of the genes that are expressed, all of the proteins that are there. I think we're going to start to see some major advances in terms of understanding exactly how this is all put together. It's still sort of in the infancy, but I think there are a lot of people working on it, and I think we'll get some probably some pretty significant insights in terms of sarcoidosis over the next 5 to 10 years.
So I want to ask a neurological question that is related to sarcoidosis, but so I have it on my spine behind my neck, and as a result, I have this ongoing neuropathy, essentially from, say, the middle of my stomach all the way to my feet, tingling every day, and I take gabapentin to sort of offset that. I have tingling in the tips of 3 fingers on both hands, and there was some discussion right after I came out of surgery for the biopsy and had all this advanced tingling that I didn't have prior to the surgery. Everybody said, well, your body will find other pathways. But now, so 2016, I'm going on 9 years.
Right.
I don't feel like there's any new pathways.
Right.
How much of that is an old wives' tale, and how much and hope, and how much of that is maybe not so much?
I mean, that's a great question, and it's always difficult to tell at the onset of the disease, because people can make quite astonishing recoveries in terms of improvement in their symptoms over time. I would say, there are some factors which lead us to think that symptoms are going to be more long-standing, and some factors which lead us to think that probably there's a good chance for improvement once we get the inflammation completely under control. So I would say, the first thing when someone comes into me that I look for is, in addition to what area of the nervous system is involved, because some are more resilient than others. I think about how long someone has had active inflammation involving that area of their nervous system. And the longer they've had it, especially if it's been poorly controlled or undertreated, the more concerned I am that they're going to have long-standing symptoms, because you can't always reverse the damage that's been done, even after you control the inflammation from the disease.
And so this idea of alternate pathways is somewhat true, but not always true.
It definitely is. Yeah, I mean, your brain does a good job of rewiring and compensating for damage that has been done, but it's not perfect. It can't completely erase things. And the more damage that's been done, especially in a sensitive area like the spinal cord, and the more that's left unchecked for a long period of time, the more you're concerned there's going to be some residual injury that's not going to go away.
Yeah. So when you see neurosarcoidosis patients, where do they typically have it in their body? Is it more likely the brain, the spinal cord, the tip of their finger? Where do you see it?
Yeah. I mean, there have been some good studies that have been published that sort of give you a breakdown of what the most common manifestations of the disease are. The most common are actually the cranial nerves. These are the nerves coming off of the brain. And of those, the most common would be the facial nerves. So people have weakness in the face when they initially present. That's a very common manifestation, but it's also one that generally improves over time. So oftentimes people only need a short course of steroids. They don't need long-term treatment, and then they improve close to how they were before this started. Another common cranial nerve that can be affected is the optic nerve, which is the one that communicates with the brain to the eye, and so it's important for vision. That one oftentimes has some longer term symptoms if people have involvement. So you have to be a little bit more aggressive in terms of treatment for that. Apart from cranial nerves, I would say based on MRI, meningitis is very common, although in terms of people who have symptoms, it's relatively fewer. So, somewhere around 10 to 20% of people with meningitis actually have symptoms of the meningitis. Brain lesions can occur, and this can occur pretty much anywhere within the brain, but often near areas where you've got some meningitis as well. That's roughly, I would say 15 to 20% of people, although there can be some other non-specific spots on the MRI that show up that are more common, but don't produce any symptoms. And then spinal cord, I would say, this is reported at somewhere between 10 to 20% of people who have neurologic complications. But in my practice, and maybe that's just a result of who gets referred to me, I probably see the majority of my patients have spinal cord disease. I mean, you are one of many that I have seen who have spinal cord issues, and it's probably closer to, maybe even 60% of the patients that I see who have those kinds of manifestations.
And is there any particular place in the spinal cord where you often see it?
It's usually the cervical or the thoracic spine. Lower cervical, higher thoracic is where it is. Which is right around the area where you had involvement too.
So the top of your back or your neck.
Yeah, right. You're right around the neck. Yeah.
Right.
Where you feel the sort of the protrusion at the back of the neck. That's right at the border of the cervical and thoracic spine. So a little bit higher, a little bit lower.
Yeah. And so when I had my terrible flare, which was what led me to you, so I was diagnosed in 2016, and then in December of 2018. I had a flare that put me in the hospital, and that was all the flare went all the way down into my thoracic spine, and it just was making that MRI glow.
Right.
Why there? And is that normal? Is there any indication as to why something like that would happen to somebody?
Yeah, I don't think we fully understand why those areas tend to be affected the most. I do think it's important to remember it doesn't just have to affect those areas. I mean, I've seen people who've had involvement all the way from the brain through the entirety of the spine into the nerves running off of the spine. So it's not just restricted to those areas, but why those areas tend to be the most effective, I don't think we fully understand.
So it's just something we got to keep studying, but luckily you treat it the same way, right?
Right. Yeah. And that's been a major benefit. So, there have been no clinical trials for neurologic manifestations of the disease. Sometimes people with neurologic manifestations are included in the clinical trials, but they're not the focus of the clinical trials. So we've been fortunate that, there has been some trials in the pulmonary manifestations of the disease and the skin manifestations of the disease, and that the mechanism of injury tends to respond similarly, for different parts of the body that are affected. So we would be in trouble if the lungs responded differently to the nervous system to the skin. But fortunately, we've been able to use some of the medications that have been identified for other organ systems for neurologic complications of the disease.
Yeah. Can I go back to the brain for a second?
Sure.
How do you know if you've got a mass in somebody's brain, whether it's a tumor or whether it's sarcoidosis? Because
You don't
it's hard to
always know.
biopsy that, right?
Right. And that's the challenge. Yeah. I mean, that's the challenge with a lot of cases, right? So including spinal cord. If someone comes to your clinic and you really can't find anything else to biopsy after doing a very thorough workup, and the imaging is consistent with sarcoidosis, the history is consistent with sarcoidosis, and you've done a good job of excluding other things that can look like sarcoidosis, you're still left with the question, do you go for a biopsy or do you just try and treat and see if it gets better? And there are, pluses and minuses to doing either one. In terms of the more conservative approach, where you say, hey, this is an area that I don't really want to touch. I don't want to go in and do a biopsy here. I'm concerned that this could cause a lot of problems. You can always do a trial of steroids, see if things get better, and then try and switch someone over to a sarcoidosis medication to see if they have benefit. And if they do, then great. The problem comes when they have either an incomplete response or they don't have much of a response after you take them off of steroids, because you're still left with this question of, is this truly sarcoidosis or is it not? When you do the biopsy, you have confidence, and that's the main thing you get from the biopsy. But there are certain locations where it gets very, very difficult to justify doing it because you're going to leave somebody with some injury from the biopsy itself.
Mm-hmm. Now, you had said to me after looking at my MRI that you were surprised I was walking, which I guess that made me feel good because like I'm beating this thing, dude, I got this, So what was it about my MRI? And then my follow-up question is what's the worst you've ever seen in terms of the patient outcome from a case of neurosarc?
Yeah, I mean, I've seen some very bad cases. I mean, I've seen patients who've passed away. That certainly happened.
Really?
And yes, and not too long after, they presented. I mean, one of the most complicated parts of this can be increased pressure within the head. People can get a meningitis. It can be very refractory to treatment. Even putting a shunt in place sometimes can be not a complete solution. So I have seen some people die, but that's the minority. That's not the majority of people who have neurologic complications of sarcoidosis. The other severe issues that I've seen have really been with the spinal cord, and I've seen some people who became quadriplegic because they had spinal cord involvement.
Really, quadriplegic, and there's no going back from that, is there?
Once it's done, it's done. Yeah.
Yeah, and boy, that's got to be tough from your perspective, as you see somebody and you know the risks and you hit them with everything you got, and then it doesn't work.
Right. And I would say, again, that situation tends to happen when people have a delay in diagnosis and a delay in getting the disease under control. That's why when I see them, and it's relatively early on, I'm pretty aggressive about trying to get them all of the diagnostic workup they need so we can come up with a treatment plan, even to the point where, I've admitted multiple people into the hospital to try and expedite things, because there's only so fast you can go when you're in a clinic setting. You can only get studies within so much time, and there can be complications in the meantime. So, I mean, I think there's some benefit to having people worked up relatively quickly, make sure you know what the treatment plan is, and then starting it so that you can avoid some of these issues.
Yeah. So you see somebody that's coming from, say, I'm just going to pick a remote place, North Dakota, and they've been suffering and suffering and suffering. They can't figure it out. Finally, they get to you, Cleveland Clinic. And by then, you can hit them with a high dose of IV steroids, but it might be too little, too late.
Right. And I feel confident when someone sees me, I can keep things from getting worse. I'm not always confident that I can improve things.
Yeah. Boy, that's got to be tough.
Yeah.
That's got to be tough. So what was it when you looked at my spinal cord that made you feel like you were surprised I was up and around and walking and riding my bike and stuff?
Yeah, I mean, in part, you benefited from the location of where most of the inflammation was, which was really within the back of the spine, which again primarily affects things like um, sensation, to some extent, your sensation of position sense, your balance a little bit. Um,
Yep.
but it did look very aggressive, and there was a large area that was affected involving the spinal cord. That was concerning. I would say I've certainly seen much worse.
Okay. All right.
So on a spectrum, I would say, you were more than moderate, but not nearly as severe as some of the cases that I've seen. But even within that, like sometimes the cord looks really swollen, it looks really inflamed, and I've just been surprised at how well people have done. It's sometimes hard to judge just based off the MRI alone what somebody's going to look like in 3 months or 6 months or a year.
Right. Um, you and other physicians who have looked at me, and I bring this up because there's so many people who've appeared on this podcast who are very active people. They're skiers, they're hikers, they're marathon runners. They are people who had pre-sarcoidosis, been able to push themselves really hard physically, and that's just their lifestyle. But you said to me, um, keep doing what you're doing, keep riding your bike, stay as active as you can. Does that
Right.
does that really help, or do I just want to hear that?
No, I mean, I definitely think it does.
Yeah,
Um, you get into a little bit of a chicken and egg situation because certainly people who remain at a higher activity level and do things like you do in terms of your biking and your endurance and your activity, they do better long term. But is that because their disease is more mild and they don't have as many severe limitations that they have to overcome? Or is that because their lifestyle is helping maintain a level of activity that they wouldn't be able to maintain if they were less active and more sedentary? It's hard to know. I think it's a little bit of both. Um, I will say that in some of these chronic inflammatory disorders, we're starting to realize that exercise, high intensity exercise, probably has more benefits than we originally realized. And they're now looking at it as a potential strategy for treating some people with severe forms of multiple sclerosis. Sometimes people who are, so severe that they need special adaptations to stay within, a reclining bike in order to complete the exercise that they're doing. But it does look like there are benefits. And I suspect that that's because it's challenging the brain, and then you are getting some of that rewiring. But it's hard to do when you've got more severe limitations.
yeah, yeah. I want to go back to something you just said a second ago about like the part of the spinal cord that it's affected for me, which was fortunate, but all the things that you said, balance, sensation, and you said the proximity thing. Um, give me say that again about the proximity, like you don't sense when you're close to something. Is that talk
Yeah,
about
so
that? 'Cause I
there are
didn't
a couple
realize
of things.
that was a spinal. I didn't realize that was a neurological thing.
Yeah, yeah. I mean, so there are a few things. So the posterior columns is what they're called, but they carry information about sensation. So numbness is a common problem that people have when that area is affected. Um, they also carry information about position sense. So where your muscles are in space. And that's
Right.
one thing that can be affected when people have involvement of this area of the spinal cord. They may not be as coordinated because they can't feel where their muscles are. They they can't feel the ground either. So this can be a little bit of a tricky part when they're trying to walk or trying to do something that requires a little bit more dexterity or more fine motor control. And then the balance can be affected as well.
So a lot of people, know that I used to be a runner and that I'm a cyclist, but I And when I tell them I can't run anymore, they kind of make a funny face at me. Like, well, if you can do all this stuff, why can't you run? And I can't explain it to them, but it really does come down to like my foot just doesn't land. I can walk, I can hike,
Right.
but when I try to run, it's awkward.
Yeah. Right. Right.
And
And I
but
suspect
I'm not
that's
making that up, right?
no. I suspect that's more because of the sensation aspects of things than it is the strength aspects of things. And that's probably what people have difficulty wrapping their head around.
Uh-huh. Is it possible that there's like a certain leg muscle that just doesn't fire anymore?
Yeah, I don't think it's strength for you though. I mean, your
Right.
exam has always looked really good in terms of the strength.
Okay.
So I don't think that's a problem. I think it's more sensory than anything else. The other thing I would point out is that sometimes people look really, really good on their exam. And then when you get them up and walking, which requires incorporation of a lot of different systems and coordination of a lot of different activities within the brain, things don't look as good. So that might be part of the problem too. You can bring out some of the deficits that somebody has by watching them walk, which you might never be able to tell just based on a bedside exam alone.
Yeah, you've always had me walk up and down the hall and try to walk a straight line and all those kinds. So you're looking for that type of
Right, right.
indicator. Yep. So what advice would you have to somebody who maybe has let's say they have pulmonary sarcoidosis because
Mhm.
that's most sarc patients, like 70% or something. Um, but they're starting to feel like maybe there's something else going on neurologically, which wouldn't be uncommon. What would you say to that person
Right,
who's seeking treatment or trying to find the next answer?
right. Yeah. I mean, I would say making sure that you are your own advocate and making sure that you get these things evaluated for is the most important thing because you have a limited amount of time, really, when your nervous system is involved to figure things out. Now, keep in mind, some symptoms are, more non-specific than others. So, if somebody has weakness in both legs and they're having difficulty walking, I'm really concerned about a spinal cord problem in that kind of a person. If someone has fatigue or cognitive symptoms, those can be due to a lot of different things. They're very common in people with sarcoidosis, and they're considered non-granulomatous complications of sarcoidosis. But they may not be due to direct involvement of the brain or the spine or the nerves coming off of them.
Yeah, that fatigue thing. What is it about sarcoidosis that makes
Ah!
it so you can't pass the couch without taking a nap? Because I was there for a couple of 3 years. My wife thought I was the laziest person on earth. I was like, I just gotta sit down.
Yeah, I wish we understood it better. And I don't think it's specific to sarcoidosis. I mean, there are a lot of chronic inflammatory diseases where people have a lot of problems with fatigue. Multiple sclerosis is certainly one of them. I do think that, again, if you can extrapolate from other diseases, there's been a lot of money that's been invested in understanding what long COVID actually represents and how best we can treat it. That might provide some other answers for things like multiple sclerosis and sarcoidosis if the causes of that are similar. My expectation is that they are, but again, it's hard to know without more evidence.
Great. Dr. Moss, anything else you want to add here today?
I think so. I think we covered a good portion of it. So.
All right. Well, thank you for the great care you've given me, and thank you for appearing on the podcast today.
Absolutely. It was a pleasure. Thanks for having me.
I feel like a zombie, just feeding and stumbling.
All right, thanks so much to Dr. Moss for joining me and sharing his insight and his expertise about neurosarcoidosis. Thanks also for his help as a physician who listens, who takes the time to get to know me as a person as well as a patient. He's always up to speed on what's going on with me before our sessions, and I appreciate that. He doesn't just sit down and look at the computer and use that as a prompt for our conversation. He knows what's going on with me. He remembers our previous session, even though it is months and months and months in between sessions, and I do so much appreciate that. And thanks also for his expertise in keeping me going. All right, it's really been helpful, and I just do it with a lot. I go forward with my treatment with a lot more confidence because I'm going someplace that really deals with sarcoidosis every day. All right, so thanks again to Dr. Moss and for him taking his valuable time to join us here on the FSR Sarc Fighter podcast. The official Sarc Fighter song is called Zombie by fellow Sarc Fighter Mark Steyer of Alberta, Canada. Mark gave us an update on his health in episode 118. I encourage you to go back and check that out. As I'm recording today, my trusty dog Dougal is curled up in the chair in my office. Dougal makes my life so much better. If you'd like to reach me, please send an email to carlinagency@gmail.com. There's a link in the show notes or the description, as it were, of the podcast. Please don't forget to give to FSR. There's an easy link in the show notes as I'm recording. It's Sarcoidosis Awareness Month. I've made my donation, and I'm asking you to join me. And again, there is a link in the show notes. All you have to do is click and get out the credit card. It's easy and it's painless, and you're helping a cause near and dear to your heart. Until next time, keep fighting.
Learn to suffer, you feel pain someday. Learn endurance, your strength will fade away. Dead man walking, trying to keep up the pace. Dead man walking, counting